The key problem we have in our healthcare is that government is far, far too involved. So if you look at how we arrange payment in healthcare, you've got the two major programs of Medicare for the elderly, which is a federal program, and Medicaid for the indigent, which is a shared program between the federal and state government. Because of the way they fix payments and because of the way they regulate the delivery of healthcare, it's very hard to work around that. It's not a true free market, and it creates distortions that are unhealthy and affect those three stools we talked about: cost, quality, and access. And so the best thing we can do, hopefully, after the 2016 election is truly go in a different direction away from a government-heavy, government-dependent program to more innovation. You know, we have 50 states and a federalist system so that states can be innovative. So I'd love to see the federal government block grant and transfer control of the Medicaid program back to Florida, where we can do things that are uniquely suited to our population, and in doing so bring down the per patient cost in Medicaid and allow us to potentially expand access or do other creative things that will improve again on quality, access, and cost. And as long as the federal government is dictating a one-size-fits-all approach, we will struggle to bring real health reform to Americans and certainly Floridians. So we need to go in a different approach. I've mentioned several bills. The other bill we're working through this year is in telehealth, so that people that are shut-ins or people that live in rural communities and have to drive 100 miles to a top-quality hospital now can Skype in or go via a secure video feed into the Mayo Clinic in Jacksonville and get a consultation with one of the world's leading providers in the area of their need. And so that's another exciting thing that we're doing on the healthcare front and will continue to do. But again, as long as the federal government is dictating the left and right limits of where we can innovate, we only have so much innovation we can do. But we are doing that in Florida, and people need to know that. We're doing some exciting things that are going to make their healthcare much improved here in the state of Florida.